Views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat and encourage you to continue participating in the program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. And as always, we promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you and the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I we'll be discussing the importance of nutrition in contributing to a healthy lifestyle.
Yes, Errol. What we eat and the way we eat has a significant impact on our health. Joining us this evening to provide our viewers with their recipe for a successful, healthy lifestyle are Karen Formato, Director, Clinical Nutrition, Bronx, Lebanon, and Dana McGeorge, Clinical Dietitian, Bronx, Lebanon. Each are experts in the nutrition field.
Now, before we hear from our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Now, let me begin the program, Ms. Formato, by asking you to really share with our viewers just what is the role of a clinical dietitian in our healthcare system.
Well, basically, as a dietitian or nutritionist, we try to decipher exactly what myths are as opposed to the facts. A lot of times patients are confused. There's so much information out there that people are exposed to. And because of that, the dietitian who has the knowledge and the education, we try to really decipher the myths from the facts. We, as dietitians, also look at the nutritional problems of the patients, the different diseases. In Bronx, Lebanon, we have a lot of patients that have a variety of different diseases, diabetes, high blood pressure, high cholesterol. So as a nutritionist, we look to see what to focus in on. What is the priority problem that we need to focus in on, what to educate the patient on, so the patient can lead to a more healthy lifestyle and better control their problems, their health disease.
Okay. Right. Expanding a little on Mr. Schneer's question, can each of you highlight the nutritional services provided at Bronx Lebanon? Maybe you can tell us what you do all day.
Sure. So we educate patients when they come in with their different disease states and help them to focus on better health overall and what they can eat, how to manage their blood sugars or their weight. We can educate them on a low-salt diet if needed for hypertension or congestive heart failure. We can help with renal diseases, a variety of things.
Yeah. Karen?
It's very important for each of the dietitians in the hospital to really prioritize. Like I said before, people are very ill. We need to really look at what a patient is able to change, what the education is, what resources they have, what tools they work with. Do they have a kitchen, a working kitchen? You know, these are the things we need to find out when we speak with the patients, and then work with that.
But things happen so quickly in the hospital setting.
Mm-hmm.
Where does nutrition fit in with all of the other procedures and all of the other things you're doing to the patient? You think the patient is paying attention to you when
That's a good question.
he is worried about...
Right.
And
that's a very important question, because when you are in the hospital, you really, like you said, you're bombarded by the doctor, by nurses, by so many other professionals.
Right.
So we give a basic education when the patient's within the hospital, but we have outpatient services that we recommend the patient go see. We give them phone numbers, where they can call, so they can do it on an ongoing basis once they leave the hospital, because that's very important. Like you said, in the hospital, you're frightened, you're scared, but hopefully the patient, when they leave the hospital, will follow up with whatever condition.
let me ask you a question, and don't tell me anything.
Okay.
Your diabetics, how often do you think they pay attention to what you tell them when they leave the hospital?
How often they pay attention?
Yeah, I mean, as far as results are concerned, do they go home and really do what you say? Do you see them again?
I think it depends on their situation. It depends on the individual and their education levels and how understanding they are. If they're willing to ask questions and really partake in the education that we've provided them. And you can really tell how interested they are depending on how verbal they are during the education session. And like Karen said, we do provide them with an outpatient setting for if they have any follow-up questions regarding what we've provided them in the hospital.
In terms of your typical day, how would you describe it to our viewers? Start from when you arrive at the hospital.
Sure. So when we arrive, we screen the patients. We get consults from nurses and physicians. And those are typically seen first for their diseases. And then we screen the rest of the floors that were assigned. So we do see all of the patients, usually within 24 to 48 hours of their admission, and address whatever their disease states are.
And did you want to add anything?
Well, basically, as a director, I oversee the policies and procedures of the department, and prioritizing what patients should be seen based on disease level. So that's my role.
Right. Now you see all these television shows that are out in the community, and people watch about people that are highly obese. Do we have that as a problem? And how do you address that?
We have obesity as a major problem, not only at Bronx, Lebanon, but it is a state problem, a nation problem.
Right.
And yes, when a person comes in morbidly obese or just obesity, level 1 or 2, we really look to see a variety of different diseases that are present. Because most times when a person is obese, there's diabetes present, there's CHF, there may be, other diseases. So we have to really concentrate and prioritize as to what we need to do first. Usually with obesity, that is really loss of weight. Needs to be done on an outpatient basis, on an ongoing basis, so people are educated and guided in the right direction.
Right.
Among the most frequently asked complaints of patients is food services. Do we have those problems at Bronx, Lebanon? If not, why not?
Well, I think we all can agree, when you go to a hospital, it's not going to be a home-cooked meal. It can't be, because we have to cook the food and prepare the food in a lower sodium way, a lower fat way, because we are a healthcare institution. So we try to focus on the patient's cultures. We have a variety of different cultures at Bronx, Lebanon, so we make our meals a little bit more culture friendly. Spanish-oriented Hispanic foods, or maybe a little bit of African-American type of foods. We try to focus in on that. And we constantly change the menu. If we find an item is not being well liked, we will change the menu every so often, just to make it more friendly for the patients.
So how often during a given day will a nutritionist or a dietitian such as yourself see a patient?
Oh, plenty.
Yeah.
Is it more than once or twice, or what would you say is
the morbidly obese patient?
No, any patient.
Or just any patient? Yeah. How many we see a day?
No. How often do you see patients?
Oh, on a daily basis we see patients. And
if the nurse calls and asks for there's a problem with the patient, how promptly is that problem addressed?
We usually go in right away to discuss the situation, and it depends again on the disease state, what we can do for them, and if they're asking for something that's not indicated for their diet, then we'll explain that and educate them on a further basis.
Right. Which leads me into my next question. What diseases or conditions do you think are most positively impacted by changing dietary habits or nutritional situations?
Diabetes, number one.
Right.
Heart disease, when it comes to elevated cholesterol, those are definitely impacted. And renal disease. I mean, we have a variety of different diseases that, we deal with. Obesity.
You have congestive heart failure too.
Well, yeah, congestive CHF, congestive heart failure. There's a multitude of different diseases, and what makes Bronx Lebanon very different is that we have a very high-risk population, so you have patients that have not just 1, 2 diseases, but a multitude of different diseases. So that makes a job of not only the doctor, but a nutritionist quite challenging, because you need to really prioritize what you do on a daily basis.
Right.
I'll give you a nice question. What is a healthy diet? And perhaps you can give us specific examples. That's
Okay,
your question.
so a
Healthy diet for me, Errol. I mean,
a healthy diet would be a good variety of fruits, vegetables, grains, whole grains, and getting a good variety of protein sources, and not just having the same thing over and over, or anything loaded with salt or deep fried, too much oils or anything like that. So having a good variety of things.
Nuts?
Yeah, a variety of nuts would be fine. Again, it's high in fat, so limiting the quantity of it. Even though it's advertised as healthy, it still has fat in it. So it just, again, it depends on the disease state of the person and what they can have.
And I think variety is extremely important in moderation. We never tell a patient you can never eat something, even a diabetic. Once you tell someone never, it doesn't work. So we have to teach moderation, we have to teach portion control, and that's the hardest thing, to learn how to reduce portions and live healthy. I mean, that's the key.
We have a question, a challenge. Lisa, you have a question?
Yes, hi. I just recently entered my 3rd trimester of pregnancy, and I'm wondering if there's anything nutritional-wise that I would need to either add to my diet or take out.
She said she's in the 3rd trimester, I think, right? Mm-hmm. Okay. Karen, do you want to take that?
You don't have to leave out anything. As a pregnant woman in a 3rd trimester, it's important that you take in an adequate amount of calories and protein. You're looking at how much weight you've gained. That's up to your doctor, but you need to look at that and determine, do you need to add any more calories or reduce your calorie intake? Having enough fruits and vegetables, again, it's a balanced diet is the major thing. Taking your vitamins as recommended by your physician is important also.
It depends on our weight gain, and blood sugar.
Absolutely.
And pressure, blood pressure also.
And that all comes down to seeing your doctor on a regular basis also.
Okay, thank you very much. Good question.
Now, you mentioned some of the common problems that are impacting our population. How are you addressing them? For instance, diabetes, heart disease.
Well, we have diabetes. We have a certified diabetic educator that's within the hospital who does a lot of classes. We have classes for CHF for patients every week.
CHF is
congestive heart failure. Twice a week we have classes for inpatients. We have a lot of outpatient classes that go on for diabetes. We have classes for diabetic children. Sugar babes, we have a lot going on at Bronx Lebanon that really helps the community.
Okay. All right, well, at that point, let's pause for a short break, and when we return, we will continue our discussion, as well as once again take calls from you, our viewers. The number to call is 718-960-7241. That's 718-960-7241, and please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery and the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, I believe we have a question from our viewers.
Albert, you have a question?
Yes, sir, Dr. Gum, thank you. My question is these health drinks, these energy drinks that's on the market. I don't want to mention anyone by name, but do they have any nutritional value? Are they safe to take? Is it something that nutritionists would recommend and stuff like that?
What about Red Bull?
Red Bull?
Go ahead.
The drinks are typically very high in sugar, so they're not always considered healthy. They are actually leading to a lot of obesity problems that we're seeing.
What about caffeine?
They have a lot of caffeine in it as well. Again, it's not something that we would recommend. We tend to go against it. Like I said, they're not nutritionally beneficial, so we tend to avoid them at all costs. And some of the other ones that are labeled high in nutrients, high in vitamins, high in minerals are typically more for adults as well that are very active, not just going to the gym for 1 or 2 hours a week. It's sports players and those sorts of things.
She's politically correct. You want to be a little less? Or what?
No, she's absolutely correct.
If not, I'll join in afterward. Go ahead.
Electrolyte, replenishing electrolytes. If you're a runner, that's important. And you can get that with a basic, water with Gatorade or something that's a little bit less expensive, safer. It's also, these drinks are very expensive. A lot of the manufacturers, their aim is not so much to benefit the consumer, it's to make money.
Yeah. Okay. Yeah. Well, I guess that's. Albert, I heard you. I think you got the message.
Okay.
Thank you very much for the question.
Now, a question we often ask our panelists is to share their respective backgrounds with our viewers. And I'll start with you, Ms. McGeorge. What interested you in getting into this field in the first place? And what does the educational background require to become a certified nutritionist such as yourself?
Sure. So I got into this because I grew up with food allergies, so it's been part of my life.
Right.
And I went to Virginia Tech to get both my bachelor's in science and master's degree. We do have to attend schools that have programs certified by the American Dietetic Association or the Academy of Nutrition and Dietetics, and it requires a 4-year school, a bachelor's degree, and then an internship. Once we do the internship, we complete that, and then we go on to take our exam to become registered as a dietitian.
Okay. Did you want to add to that? In terms of your own background,
my undergraduate degree was here at Lehman College, where this is being broadcasted from. My master's was from NYU, and did the same thing as Dana. Went through a dietetic internship in order to gain practical experience. and moved on from there.
Right.
Worked in various long-term care and acute care settings.
Right. Now, you had mentioned to me during the break that this is a tremendous opportunity for people in our audience to pursue professions in the field. Perhaps you can briefly elaborate on that.
Well, the field is growing. It's only over the past 2 or 3 decades where people are learning the impact of good nutrition, not only on disease, which it definitely impacts, but also on longevity. And it must start at a young age. And what we're seeing, unfortunately, because of inactivity, computers creating inactivity in children, and it's causing obesity problems. And we need to really focus in. Because the latest research is showing that children may not live as long as us, and because of all the problems with obesity, and we need to do something about it. And it is a field, if you want to help other people, it's a field where we can grow and help society change.
Okay. How does a clinical dietitian decide the nutritional needs of individual patients? And are there instances when the entire family has to be brought into the mix?
Especially if there's children involved, because obviously children are not preparing their own food, so the whole family has to get involved, the mother and father. But yes, it's important. The education part is very important. As dietitians, we do calculation to determine how much a patient may need, calories, protein, what they actually need, whether to maintain their weight or lose weight. But the priority is education, and education of the patient, meaning that we teach them how to eat healthy, what is the right way to balance the meals they eat, what they can eat, what they can't eat or restrict. We try to just advise them and to guide them in the right direction, so their life is more under control when it comes to controlling whatever problem or disease they may have.
Well, in healthcare, I have been very nice all night, so I can be bad now. I don't think the message gets to the patient as much as we think we get. For example, I just came back from vacation, and I saw, over the holidays, and I saw a lot of people eating a lot of food. There was no regard for taking care of their health, really. And I see that throughout the country and the world sometimes.
Yeah.
Want to comment on that? What do you see in Virginia Tech? What do they do there?
Well, I think that some of it comes from just not being educated and realizing the impact of their intake. Even if we tell it to them, they might not see initial negativities that come out of it. And I've seen a lot of people recently that think that medications that they're taking is a fix-all, and they don't realize that it's got to be a good combination of both the medications and the good nutritional status.
Yeah. It's a long-term commitment.
Yes.
Which I think is lost.
Yeah. There's no immediate results in making a small change. It's the long-term results that, it's hard for people to have patience and wait, but if you do make the changes, there will be changes long-term. Whether it comes to decreasing your cholesterol intake and reducing heart disease and controlling your diabetes, it's the long-term effect that really is the most important.
Okay. Now, we discussed the obesity issue before. How do each of you feel about the quick solution to the problem, these over-the-counter remedies that are out there? Is that a possibility, or what's your feeling?
It's a possibility if you want it temporary. You could take a pill, anyone can take a pill, but it's temporary. The long-term effect of moderation in diet and exercise, I mean, that's the newest thing. 30 years ago, people didn't really talk much about exercise. Now you need to incorporate that. That's the only way you're really going to balance your diet and your activity level and make a healthy lifestyle, so you maintain the adequate weight that you should be at.
Every now and then, you talk about what you're saying now, so people try an alternative. They try to get their calories and whatever nutrients they need in juicing. Where do you stand on that? Do you want to take on that? You look like a non-juicer.
No, I'm a non-juicer.
What do you think about it? There are some people who do juice up.
I think it depends on the situation and the person and what they want to do with it. If they're juicing and adding other things into it, like high-calorie ice creams and yogurts and milks, and trying to make it creamy, more like a milkshake, it's not really helping them. It's just more high-calorie, and they're losing the fiber intake in it. And I always tell patients that you can have an apple and an orange and a pear, or you can just drink its juice. What would be more filling and what would be more satisfying? So you do tend to lose some of the value of the food that you're juicing, whether fruits or vegetables.
Yeah.
When you just drink
But every
juice
now
from
and then
it.
it's not so bad, right?
Every now and then it's okay, but not as a meal replacement every day. It's not.
Now, another question we ask our panelists is to share their success stories with our viewers, and I'm sure each of you have had quite a number of successes in terms of getting people to change their diet habits. Perhaps you can just briefly mention a few that come to
One
your mind.
diabetic, for example.
One of the recent success stories was a newly diagnosed celiac patient, and she didn't have any idea what the disease was, what to do with it, what foods to avoid. And after spending quite some time with her and her family member, we were able to straighten her out as far as what she needed to eat and what she needed to avoid, and maintaining her nutritional health.
I think recently there was an article in the Times about something like that. Okay, you want to be any success stories?
Well, I think anybody, we deal with so many patients each day, but I mean, if you look at patients who actually lose weight by incorporating exercise and changing their diet and doing it without, surgery, doing it without medication, doing it naturally and gradually, not quick, long term, that's a success story. Those are people that listened and wanted to make a change and took your advice, and that's important.
Do you fight with doctors about nutrition?
Occasionally.
Why?
Just from lack of education, just like I might not understand some of the things that they do, and then you just have a conversation.
But basically, you interact quite frequently with the
every day.
doctors.
Every day.
Yeah, we make recommendations and, what patients may need, and, the doctors are the ones who actually place the prescription.
And the suggestions are followed as a rule. Yeah.
Usually.
I'll call you tomorrow for more.
Okay, well, on that note, let me thank Ms. Fermato and Ms. McGeorge for joining with Dr. Gumbs and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, you, our viewers, if you have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99 That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.